So this is the first questions. How do you see the interplay between the reproductive system, including uterus and ovaries, brain and heart in women's health, and how can holistic approaches like heart coherence, intermittent fasting, and hypnosis address the underlying factors that impact all three systems? So I'm going to give you.
Yeah, okay. Starting with me. Yeah. Okay. Thank you again for hearing me. This question actually is a huge question, and a wide variety of answering would be covered. But I summarize my answer about this question. How do you see the interplay between the reproductive system? Actually, the mind-body connection and mind-body relationship is established in every text, including papers, the textbook, and all of researchers. I had lots of experiences with my patients and women who came for passing pregnancy and vaginal delivery. I want to explain a memory. It is a novel memory for you, and you can find your answer in this experience. One of them came to me. She was studying psychology, and she and her husband's sister was pregnant at the same time, and they are living in the same place. At the first level, her husband parents. At the second level, her husband's sister. At the third level, she was living there. And she was many of engagement and negotiation with her husband's mom in many aspects. They were opposite to each other. 1 week before this lady, her husband's sister went to cesarean section. Why cesarean section? Because her mom said to her husband that vaginal delivery is painful, and I want to have my daughter to have a delivery without any pain sensation. Because of this, you should select cesarean section. The next week was the time of my patient. She told me that I offended why she goes to the operation room for cesarean section, but I should do vaginal delivery. What's the difference? Because expenses, just expenses. And grandma said that no, you are a different person. She had some complication in obstetric issues and so on, and it was just some cues, not really. And she said that I asked midwives in operation room, in delivery room, what's the difference and how you categorize some patients go to operation room for cesarean section and someone you don't choose them. And she said it relates to your baby situation. And she said, I put my hand here and I said, my baby, don't move. We should win and overcome to your grandma. After 10 minutes, the baby was completely silent, without any movement. And the midwife called gynecologist, and the cesarean section as urgently situation has selected for this client. And she says, when we we were passing to operation room for doing cesarean section. This old woman was standing at the salon, and I was a winner. This is the power of mind on uterus. Now, this is interplay between the reproductive system and brain. We have many patients who are non-productive, infertile. They are infertile. And also many patients who have experienced abortion, many times abortion, 2 or 3 times abortion. After sessions by hypnosis, they were succeeded to be pregnant and to be delivered their baby. But the key point is that hypnosis can balance the brain. Dr. McCraty, I appreciate your presentation because it was so scientific, and I enjoyed that as a scientific man. I'm professor in university, and I know the brain because of my career is engaging with the brain. It was so great that I heard you today. The key point is that when we are focusing on something, we can change our brain waves. And also we can change our heart rate. And also we can change our emotion and our behaviors. One of the role of hypnosis is balancing between oxidative and non-oxidative, oxidant and non-oxidant. And as you know, when we have facing this balance between oxidant and non-oxidant, immune system would be so weak. And autoimmune diseases would be raised. And one of them is abortion. One of the etiologic factors of abortion, emotional situation of the patient. With hypnosis, when you do hypnosis, hypnosis can balance their mind and their emotions, and also the releasing of their neurotransmitters. For example, endorelaxin factor in the uterine results. We have many studies in our university for patients who were candidated for open heart surgery. One day before their operation, we hypnotized them, and they imagined they are coming to operation room, and someone like me is welcoming them. And after arriving to operation room, we got blood sample and examined blood sample in aspects of oxidative and biomarkers of stress releases. And the result was amazing. The level of stress was so lesser than other patients, and they were so calm. This is an indicator that mind-body connection is so important. And if you can use hypnosis or meditation or other techniques that enhance interpersonal relationship between us and our clients, you would be successful in using lesser medications, even during general anesthesia. Because in our textbook of anesthesia, who is Miller's anesthesia, says that even in deep general anesthesia, your wakefulness would be arised again. and the patient maybe hear some negative suggestions during surgery, who is inducted by environment of operation room. Because of this, be cautious about talking with each other. Don't think he is in deep sleep and he doesn't hear anything. That's my point.
Thank you, Dr. Fethi. So we're gonna let the other panelists interact with you
Yeah, sure.
as well. Like, and talk about the interplay between the three systems and how their heart coherence and intermittent fasting could play a role into that as well. I'm gonna let Dr. Mattson maybe to start.
Yeah. Well, neurons in the brain have estrogen receptors. They respond to estrogen, and it has very important roles in brain development of the female brain and in the changes in brain that occur during the estrous cycle, menstrual cycle. So, for example, there's studies showing, at least in laboratory animals, where you can actually euthanize the animals at different stages in the estrous cycle and look at, for example, number of synapses on neurons in the hippocampus, a brain region critical for learning and memory. During the cycle, when estrogen levels are high, there's increased number of synapses. And then when it's lower, they decrease. And so brain performance can be changed during the menstrual cycle. There's been no studies looking at this that I'm aware of with intermittent fasting. There are studies, including in humans, showing that intermittent fasting with the kind of eating patterns I talked about in my presentation, daily time restricted eating, for example, or 5-2 intermittent fasting, don't seem to affect the estrous cycle much at all, or the reproductive hormone levels. Yeah, so with menopause, so early on, a lot of my work was related to brain aging, Alzheimer's, Parkinson's disease. And there were some early studies suggesting that postmenopausal women who get estrogen replacement therapy have reduced risk of dementia. But then that hasn't held up at all. So there does seem to be benefits of taking estrogen during the few years of the menopause period. So I guess what I'm saying is, as far as brain goes, long-term estrogen therapy is not beneficial after menopause, but there is some evidence that short-term during the menopause may have some benefits. Yeah, then there's another aspect that this of too is the interrelationships between stress, the brain, and the heart. So when most of us think of stress, maybe the lay people, they think of stress as a bad thing. I think of stress from the viewpoint of cells and organ systems, and from that standpoint, there's a lot of good stresses. Exercise is a stress, fasting is a stress, using your brain cells, like hopefully we're doing now, is a stress. Just like when we exercise our muscles, when we exercise our brain cells, there's ionic stress, metabolic stress, increased free radical production. But the cells respond adaptively in good ways. So the stress issue is, chronic emotional, psychosocial stress is clearly bad. And this is Hans Selye up there in Montreal. It's kind of the godfather of stress research. And he actually, in his early work, defined two types of stress. Distress or emotional stress, chronic psychosocial stress, bad stress. So that's the bad kinds of stress, and eustress or good stress. So I think that kind of the idea as far as health in general, women's health, probably issues related to the issues they uniquely deal with. You want to subject yourself to mild, transient, intermittent stresses, stresses, good stresses. And these are what we evolved with. I mentioned this in my first slide. It's very important to think of all this in terms of evolution. So in the reproductive system, so I mentioned that, so we did these studies in rats, male and females, and we did different levels of calorie restriction, kind of a moderate level, severe level. We did every other day fasting. And in the females, we looked at their estrous cycle with the intermittent fasting or the mild daily calorie restriction. There was no major change in the estrous cycle. When we severely restricted calorie intake, like anorexia in humans, they shut down their cycling. So that makes a lot of sense from an evolutionary standpoint of there's no food around. A female doesn't want to get pregnant because she hasn't not taking in the energy to support the development of the offspring. Right. On the other hand, we found the males, even with severe calorie restriction, they stay fertile. Their sperm count doesn't go down at all. So from the male standpoint, if there's no food around, you want to inseminate as many females as you can, or be able to anyway, before you die of starvation. So maybe your genes will be passed on. So these are the kinds of ways I look at this. And we're animals, right? Humans are animals, and we're not really different in 99.9% of the ways from, say, non-human primates or even mammals. Yeah, so I think as far as integrative medicine, preventative medicine is and it's not done much at all in the United States, right? You go to a doctor for your yearly checkup, maybe your blood pressure is going up a little, you're starting to get insulin resistant, and they'll say you need to exercise, maybe cut back on your calorie intake, and then they turn you loose for a year. You come back the next year, and lo and behold, your blood pressure is a little higher, you're starting early diabetes, and then they put you on drugs. And this is not an efficient way to do healthcare. We need healthcare systems where you go to a practitioner and they prescribe an specific exercise regimen, a specific eating pattern. And then they follow up with, you could use social media, text messaging, and follow up with people like on certainly a weekly basis for the first several months that they're trying to shift their habits into subjecting themselves to good stress, whether it's exercise, fasting, or even the toxic chemicals in fruits and vegetables that we eat, which, by the way, the reason fruits and vegetables are good for us is that there's chemicals in them, that the function of those chemicals in the plants is to keep insects and us from eating very much of the plants. So all these good chemicals in plants are bitter tasting things, right? So anyway, it's important to tap into these evolutionarily good types of stress. That's kind of a general view, and that's true for men, women, and probably for the health of brain, heart, all our organ systems, gut and reproductive systems.
Let me to make a bridge between my opinion and Dr. McCraty and Dr. Mattson. We have a technique in psychology and hypnosis using as entitled emotional self-regulating therapy. Emotional self-regulating therapy means that you can regulate your emotions. Please pay attention that our brain doesn't have set for calmness. It's wrong. Just diet brain is so calm. Yeah, sure. It should be active. If not, we die. Yeah.
Yeah.
Our role is balancing that. In Muslim countries, they have 1 month fasting from entitled Ramadan. They would be fasted from early morning to sunset, including liquids and solid foods. And after sunset, they are allowed to eat and to drink. They emphasize by religion to be in meditative state, think about your function, think about your emotions, and regulate all of them. This is emotional self-regulating in adding to fasting for 1 month. It's not intermittent, 1 day eat and 1 day fast. 1 month continuously they would be fasted. Maybe this is a good bridge between heart and connection with brain and regulating emotions by fasting. What do you think about it?
Yeah, so from the data on intermittent, so what the Muslims do is daily time restricted eating, which is a form of intermittent fasting, as I mentioned. Now, depending on where you live on the globe, it's Ramadan right now, right?
Yeah.
So depending on where you live on the globe, the time window of daylight may vary, right? And the studies that have been done in humans suggest that you have to have a fasting period of at least 12 hours and ideally 16 hours. So I think a couple kind of bits of advice for the first is you guys are 1/12 of the way there. You're doing the intermittent fasting or the daily time restricted eating for 1 month out of 12 months. It would be better to do 12 months. And then the other is, try to shoot for 16 hours of fasting.
I just want to like specifics. They do fast for 1 month, but they're supposed also to fast at least 2 days a week for the entire year. The only problem is the way they break the fast. They could not eat a lot or eat cookies. That's the problem.
Yeah, they compensated after everything. Yeah. Let me to ask Dr. McCraty for sharing his great and valuable opinion about polyvagal system. What do you think about the role of polyvagal system and body language effect on our emotions regulation?
Okay, so, all right, I can go there. Yeah, I know Steve is a friend of mine, actually, Steve Porges, who, of course, created the polyvagal theory. Yeah, if I'm really honest, I mean, what he's talking about in the polyvagal theory is, the myelinated and unmyelinated fibers of the vagus coming from different sources within the brainstem, and that's all fine, totally supported by anatomical research and so on. And I think it's been very helpful for clinicians to understand, how especially trauma and lack of self-regulation, frankly, affect physiology. But something you just said, I think, is actually more important that I tend to talk more about that Steve introduced, and I think is infinitely more important actually is his coining the term the self-regulation system. And the social, well, actually, he called it the social engagement system, which is, there's several other theories, one from neurocardiology and one Julian Thayer and his group of it's all the same circuits that people are talking about.
Yeah.
And I think this is the capacity that makes us humans different than a lot of, whether you're studying mice and rats and other animals, is we do have the self-regulation and emotional engagement system. One of the things that drives me a little crazy, frankly, is when I hear stress management courses that talk about humans as we can fight, flee, or freeze. Well, that's nonsense. We do have the social engagement system. We can choose to self-regulate and not have to hit somebody or run away from them or freeze, right? You don't not you have to agree with them. So I think that's one of the more important aspects of, that is an aspect of Steve's polyvagal theory.
Right.
He also talks a lot about the afferent sides being really important, which I also appreciate about Steve's work, because that's often forgotten and left out of these kind of discussions, because the afferents have as much influence as the efferents and more, especially in those as I mentioned in the frontal cortex, which gives us foresight, which is another aspect that's unique to humans. In the most part, is that the foresight, which is directly tied to our capacity to self-regulate. Dr. Mattson also mentioned Sile's work, and I want to comment. One of my mentors and good friends for many years, he's now passed away, was Paul Rosch, who was president of the American Institute of Stress, created it and founded it, who worked directly. He was one of Sile's students and worked with him, and it was Sile that asked him to create that organization. So I know through Paul that Sile really regretted introducing the term eustress or good stress. He wished he hadn't done it. And what I learned from Paul was, what we use the word challenge for good stress.
Yeah, I do. I use that word too.
Yeah, because challenge is a good thing. We have to have challenges. The problem is, and this is what's rampant in society, I hear it from everyone all over the world right now, is that the amount of stress that people are undergoing is more than their ability to deal with it, to cope with it. And that's really a problem I think we have globally right now.
Yeah.
From a coherence perspective, trying to address your question here, coherence is the whole body, it's the whole system, including the uterus, right? But the uterus is primarily a target organ for reproductive hormones, even though I think some research, and this is not my field of expertise, that is suggesting that it's also part of the endocrine system, with growth, especially with growth hormones and so on. And so is the heart. It had to be reclassified in the 1980s as part of the hormonal system because it secretes atrial peptide and now all the catecholamines, but most recently oxytocin. So the heart produces as much oxytocin as the brain. In fact,
It also produces BDNF.
yeah, so does the heart. Yeah, that's just,
Yeah.
anyway, so I think we have to look at the system as a whole, as a complex system. They all interact with each other, and getting more into the kind of coherent state, we're increasing vagal tone and reducing inflammation, stress hormones, which certainly supports uterine health, right? From that perspective. I'm not going to say a lot about intermittent fasting. That's not my field of expertise. On the hypnosis part of your question here, though, I just want to tell a quick story. And I learned actually when I was in my late teens, early 20s from my mother that I was actually delivered under hypnosis. My mother was hypnotized
So great.
rather than getting any drugs or medications.
Yeah.
So I got intrigued by that, and this was turned out to be a country doctor in a small town so I said, I'm going to go meet. I want to go talk to him. I knew him. He was been our family
Amazing.
physician.
Amazing.
And talked to him about this. So I spent quite a bit of time with him. We ended up becoming close friends, actually. And it was actually an influence in my early career in a way. So he taught me hypnosis, and we did past life regressions and taught me how to hypnotize people. And it was pretty cool. He told me a lot of stories where he had used hypnosis in his practice, in his clinical practice,
Hmm.
instead of, drugs and medications and so on for pain management and a lot of different things. And as it turned out, I was, I was a communication engineer. I'd kind of completed my degree at that time. And he asked me to fix this machine he had in the back room. And as it turns out, this man had invented vector cardiology and wrote the test for doctors to become doctors. I mean, just from this country doctor, just way ahead of his time. So I think there's a, this is the 1950s, right? A guy using hypnosis in that way. So anyway, I
Yeah, sure.
wanted to make that
Boss, boss,
comment there.
do you agree for changing atmosphere here? Now, we do a live practicing right now with audience. Yeah. Uh, could you share with me, please, stand up? We want to try emotion regulating therapy and coherence between your brain and your heart. We cannot practice fasting right now, but we can do another thing. Okay, so lose your body, lose, not tense. Lose, please, and look down and make your lips like me, like a sad people. And your eyes looking down. And now remind one of your failure in recent weeks. And imagine it so survive. You are at that time again. You are negotiating with that. Maybe some person, maybe some event, maybe something else. And now pay attention to heart rate. It rises. Now, please stand up straight. And your shoulder so straight. So body language of confidential people. And look straight forward. And think, I'm enough. And repeat it with your mind. I'm enough. And when you are talking I'm enough, push your leg to the earth. I'm enough. I'm enough. I can do it. Now pay attention to your heart rate and change your facial impression. This is the effect of polyvagal system on your mind, your coherence of your heart, and regulating of your emotions. So, psychologists suggest us that look inside and forward, not backward. Backward is backward. Backward is past. You have some potential inside. Look at. And some visions at the front of you. Look at. Look inward and look forward. This is your role. Thank you.
Rollin, I wanted to ask you about it. It would be interesting to do some studies looking at. So I mentioned that we found that heart rate variability increases when animals are adapted to intermittent fasting. It would be interesting to look at coherence with that. And has it been looked at with hypnosis?
I'm not,
Coherence?
I don't know actually, if it has or not.
I mean, we got a couple studies that
Yeah.
you could do, right? It's,
Yeah, no, I am aware of the intermittent fasting literature on life extension and in animals and so on, and it's probably true in humans as well. I actually was the consultant for a funder actually in oh God, what was the name of that group? It doesn't matter, but they offered a $1 million prize for
Ah,
people who could extend decrease the aging process. And the metric that they chose, where I was a consultant on it, was heart rate variability. In other words, to win the money, you had to show that an older animal had the HRV, whether it ended up being animal models because it was a year-long thing, but it had the heart rate variability of a younger animal because it is
so
one of our
you must know Ed Licata, no?
name's familiar, but I can't say I
He's the
know.
chief of the cardiovascular science lab at NIA where I was.
Yeah,
He's
no,
done a
I
lot of
don't.
that's okay.
Dr. Mattson, do you know hypnosis can help fasting to be tolerated?
Sure.
We didn't know.
You know, so there's hypnosis.
That's so amazing.
So I'm thinking, I'm just wondering, you know, what's the role of distraction and focus on this? So I have chronic pain because I have a genetic mutation in a gene encoding a voltage dependent sodium channel. And so I play chess. I found like when my pain gets really bad, I play chess. You know, and these time games, say 20-minute game, 10-minute game, I'm completely focused on the chess match. I don't notice any pain at all because I'm focused on that. So is what is that all hypnosis is doing is getting people to focus on something else than what's being done to them or their pain, say, from giving childbirth? It's just so, for example, if you had a woman chess player that was pregnant, and when she's giving birth, if she plays a chess game, was by the end of the chess game, the baby will be out. And, you know, is there anything I'm trying to understand? Is there something different about it?
Yeah.
I can also comment on that.
I have a chance to live between many people who were fasting during Ramadan, and many of them came to me that do something for better tolerating that, and I hypnotized all of them, and they they forgot that they are hungry, they are thirsty after evening. It was so
Yeah,
amazing.
makes
No,
sense.
no needs to eat, no needs to drink after a starving time. It was playing for me, but it's a fact. We cannot ignore that. If your mind is engaging with something
Yeah,
more important,
yeah,
you forget your drives, like sex, like to be hungry, to be thirsty.
yeah.
And this is the power of redirection of mind from something to other things. Okay.
I can also kind of make some comments on this. And, heart math, by the way, and coherence training and feedback is used in many pain clinics, actually around the world. And two aspects on that. Well, ultimately, pain is a perception, right? And and I say that with a lot of compassion for you and other people that have pain, but many examples, especially in wartime, where someone gets severely hurt, but they're in harm's way, they don't feel any pain
Yeah.
until they get back to safety, right? And then can focus on that, which is related to what's called inattentional blindness. I don't know if you're familiar with that work or not, but we literally only perceive what we pay attention to. A lot of research supporting that. But then there's also work in neurocardiology that shows that the afferents coming up from especially the cardiovascular system don't all go up to the NTS. Some actually turn and go down into the spinal column and modulate the pain pathways, the thalamic training pathways. So when we're in coherence, we are increasing vagal afferent traffic above and beyond normal, and we're increasing the order of those signals. So not only that is also inhibiting the pain pathways when we're in that state directly. So there's two, and if you're doing the emotional aspect of the coherence work, you're also shifting perception. So like you're playing chess, you can also focus on appreciating something or
Yeah.
breathing a feeling of calmness, for example. So those two factors combined, I think, are why it is. So in fact, there's several studies published on this in pain as well in coherence training. So that would be another
And this is the
aspect.
mainstream of my speech in workshop in this evening. The changing from threshold of perception of pain and sensation of pain and toleration of pain in the brain. Changing of these threshold would be able by hypnosis and redirection of mind.
Yeah. And by the way, I just wanted to also comment the exercise you just did with the audience there. It goes back to the 80s, the experiment, put a pencil in somebody's mouth to force a smile, right? They feel better. As it turns out, there's 60 some muscles in the face for smiling. About 40 of them, when you smile, where they synapse into the brain at, this is amazing, is exactly the same place as the cardiovascular afferents.
Yeah, sure.
So facial expression, where we, express and read emotions, is exactly the same place that the afferents from the heart synapse in the NTS. I mean, it's not close; it's the same place. So the face and heart are our two primary biasing mechanisms to the input to the brain, which then goes through a pattern matching process. We call it baselines. Then the higher brain stuff is monitoring and labeling those patterns and whether how mismatched or matched they are. That's a whole other discussion that we don't have time to get into, but it's critically important because there is no such thing as sustained change or emotion or those deeper emotional or subconscious emotional biases and perceptions without shifting the baseline that we're comparing the now to, because the brain wants a match, right? So whether that's pain or whatever, if you've established that as the baseline, once that baseline is established, the brain wants a match between the now, the current, and the established baseline reference. That's when we feel comfortable. So we whether it's hypnosis or actually Dr. Carl Pribram, really famous guy, also he actually proved this. It's not a theory, that the only way to establish or change an existing baseline is to change the afferent input from the body, primarily from the cardiovascular afferents, but also other breathing and other rhythms in the background.
Thank you. Let's turn to audience. Yeah.
So you have something to expect them McCraty to measure maybe leptin during hypnosis and endorphin as well. So that's a good topic. I don't know if we have time to do like a second question quickly before we turn it to the audience. I have an interesting question, like from a holistic health perspective, what can we do to demystify the PMS, premenstrual cycle, especially considering the physiological and emotional interplay between these systems? Like, because women are so often misunderstood during this cycle. So what do you have to say? What is the data, the scientific data connection between the brain and hormones and emotions as well?
Okay. Any comments from audience?
Well, I mentioned this in my talk. There's quite a few studies on effects of intermittent fasting on the cardiovascular health indicators in women. So improving insulin sensitivity, improving cholesterol profile, and let's see what else. Mental health. No, that's an interesting one that hasn't been looked at all. We know that physical exercise is really good for mental health, and there seems to be a role for this neurotrophic factor BDNF in that all of the antidepressant interventions from electroconvulsive shock to serotonin norepinephrine reuptake inhibitors, even the psychedelics, they all increase BDNF, and at least in animal studies where you can manipulate BDNF, the increase in BDNF is required for the antidepressant effect. So as much as intermittent fasting impacts on the BDNF system, it could, but that's something that needs to be looked at. As far as hormonal balance, I mentioned that at least a few studies where they measured estrogen and progesterone there weren't any changes with these. And I should say the intermittent fasting, particularly time-restricted eating, is a normal. It's actually evolutionarily speaking, it's an eating pattern that's not a big deal. 3 meals a day plus snacks is abnormal in my view, from the way our systems have evolved to adapt. So it's not surprising that there aren't any negative effects of these short fasting periods.
In general, like by reducing depression, for example, for women. We cannot affirm it.
I don't think you got
Yeah.
Sure.
Can you hear me now?
Yeah.
Okay, so I was saying, does intermittent fasting reduces PMS symptoms? Can we say that? Can we affirm it, or it just reduces?
No, I haven't. I haven't seen any studies. I try to keep up on the literature. There's so many studies coming out in the last 5 years, but I haven't seen anything, and I don't know if anyone in the audience has any. Can you ask Sarah? Can you ask people in the audience to raise their hand if they've tried intermittent fasting eating pattern?
Yes. Actually, it's all of them, mostly, who try.
And any of the women have any feedback, like anecdotally?
Yes, yes.
And if you fast too much, especially in the phase where there's progesterone that's being created, it actually inhibits progesterone. So it's very important to not fast as a woman who's still menstruating after the ovulation. Actually reduces sex hormones. So the fasting period is very important before ovulation and not after ovulation.
Okay, so we had like one feedback. She's a naturopath, and she said that intermittent fasting is not really recommended during the progesterone phase after ovulation. So that's one of her insights. So it doesn't really reduce the symptoms, what you're saying, right? If we fast after ovulation.
Not think that it has to.
That's right.
Need to have incidental effects on the premenstrual syndrome, because if you have not enough progesterone, then you'll have more negative effects on estrogen and more inflammation, more mood swings, everything.
Okay, so it looks like it's not recommended right before the woman is menstruating, because it's going to exaggerate the estrogen levels and effects. So that's why we need to adapt like fasting to women.
Is there any public, but is that anecdotal, or is there any published papers? I'm not aware of.
There is a book, Fasting Like a Woman, right? Yeah, Fasting Like a Woman. I think it's a doctor who wrote this book. Yeah, she's talking about how women should be fasting according to their hormonal cycle.
Right, but does she cite scientific papers where they've done randomized controlled trials?
Yes, she's a scientific as well. So I can send you like the reference for her book.
Okay.
Perfect. Okay, so let's see if what can we say about hypnosis? Does it like reduce the PMS symptoms? Okay.
Sure. Yes, absolutely, yes. And there are many papers in medical journals around the world that indicated that hypnosis can reduce premenstrual syndrome symptoms and signs like flushing, and also emotional state related to premenstrual syndrome in women, like their self-confidence and life expectancy. All of them would be helped by hypnosis, but not just hypnosis. Clear your mind about hypnosis. Hypnosis is not therapy itself. Hypnosis is a matrix that all therapies can do in this matrix. For example, you can hypnosis the patient, and after that, your patient is in PMS, for example, and you hypnotize her, and after that, you should use insight therapy or cognitive therapy or the interpersonal therapy during hypnotic state. Hypnosis is not itself as a therapy, just is a communication skills between us and our client. Now we should know many techniques which do during hypnotic state, because during hypnotic state, mind resistance for reception new aspects and new ideas would be so reduced. And hypnosis effects on emotions and on thinkings. Regarding this manner, hypnosis introduced to the scientific text in 4 categories. At the first, traditional hypnosis, it was just suggestion. It was something like Freud and Charcot were using that. But it was not enough. After that, cognitive hypnotherapy introduced to science. What is cognitive hypnotherapy? Doing cognitive recognition of cognition distortion during hypnotic state. And after that, hypnosis using in psychodevelopmental period. And it was psychodevelopmental hypnosis, entitled psychodevelopmental hypnosis, focusing on empiric maladaptive schemas. And after that, Ericksonian hypnosis added to other techniques of hypnosis. In Ericksonian hypnosis, you give some suggestion in subliminal level to the client. It works subliminal and unconsciously during full awakeness and full awareness. This is a lifestyle, not just a technique for therapy. Hypnosis could be as a lifestyle. In this lifestyle, verbal suggestion and verbal patterns is so important. During verbal pattern, you can convince others. You can convince and you can induce something for sale, for convincing others to be better than before, to live nicer, to live more effective, and to be mental tough persons. Mental toughness is one of the most important that everyone needs that.
Resilience.
Resilience is a big part of mental toughness. Not just only resilience. Resilience is one of that. For example, resilience, patience, and also keep your hopefulness and keep your optimistic emotions. Yeah, and mindfulness, and all of them combines mental toughness. And hypnosis should act this role for all of us in our lives, not just a technique for using in our offices. No, hypnosis can live with us. Actually, we are living in hypnotic state. Everything you believe that, you convinced by other people or other thinking.
True. We're influenced, yeah.
If you think you are enough or you are not enough, in both aspects, you are right. Why? Because when you are thinking that I am enough, your confidential state would be so different. Who induced that you are enough? Maybe your parents, maybe your thinking, maybe you're evaluating, and so on. Regarding time, let me stop it, okay?
Yeah, thank you.
you.
Maybe just one last comment for Dr. McCraty to wrap up. Do you have any data regarding like heart coherence and reducing PMS?
Yes. I mean, it's really yes to all of these. There are, like I said, there are hundreds of studies, published, peer-reviewed studies on really everything you list in terms of the coherence practices, especially mental, hormonal balance. Yes. Mental health, many studies. In fact, I would go as far as saying that coherence training, really learning how to emotionally self-regulate, is certainly as important, if not even more important than, diet, and exercise. It certainly is up there. And many of our studies have been done in women as well. Not just our studies. Like I said, there's over 500 independent studies now that have looked at this in many populations around the world, actually. So, a resounding yes to that question. And I think we're past time, so probably I'll keep this short.
Thank you, Dr. McCraty. Do you have any questions? We have just 5 minutes left. So if you have questions. Okay, perfect. So I'm going to leave you here then. Thank you for all of you for this very interesting discussion. So I will just send you like the link, Dr. McCraty, after this meeting for